With case counts continuing to rise, the central government says it will explore the possibility of creating makeshift medical facilities for COVID patients. Central Epidemic Command Center head Chen Shih-chung says many countries have already done the same to cope with their COVID outbreaks.
In this animation, a 3D model of a negative pressure isolation unit is built from the ground up. Last year, National Cheng Kung University and the firm Bioarchitecture Formosa designed this mobile medical unit, which looks like a simple modular home and can be constructed in just 3 days. It has 4 pings of floor space, 2 pings of patient sleeping quarters, a 1-ping washroom, and a 1-ping workspace. It can serve as a quarantine space and provide medical services like x-rays, as if a miniature hospital. The prototype design was released last year as an open-source document with an invitation to the world to download and use free of charge. Now, amid Taiwan's local COVID surge, it's once again captured attention. With hospitals overcrowded in Greater Taipei, there have been calls for the government to build makeshift emergency hospitals to provide centralized care for COVID patients. On Friday, the head of the CECC said it was open to the possibility.
Looking for ways to construct medical facilities outside of the pre-existing facilities. That's something everyone does, and we will not be an exception. We'll do this to whatever extent it is possible. To be prepared is to be safe.
The issue of makeshift hospitals reared its head this week after several mild COVID cases were found dead in their homes or quarantine facilities. Some experts propose building emergency field hospitals like the NHS Nightingale Hospital in the UK.
In the future, as this epidemic develops, perhaps we'll find alternative ways to handle COVID cases. Alternative solutions like the one mentioned by the reporter who raised this question. We'll be in constant communication with the central government over each and every potential alternative.
Local officials said they hope to explore alternative quarantine solutions with the central government. Experts warn that many supporting measures are needed to support the creation of makeshift hospitals.
In these makeshift facilities, you'd ideally want patients to be situated one to a room, and you would need appropriate medical manpower, enough physicians and enough nurses. That way, if something goes wrong, you'd at least have the manpower in place. With COVID-19, sometimes the patient deteriorates quite suddenly after symptom onset.
With medical resources stretched thin, the CECC said it was open to adopting practices used in other nations to safely situate confirmed COVID cases.